Quervain's tenosynovitis causes sharp wrist pain that can really disrupt your day. But most people don't realize that simple, effective exercises can actually fix the problem for good. Hey everyone, Dr. Jeff Peng here. I'm a sports medicine doctor currently practicing in the San Francisco Bay Area, and I treat hundreds of patients every single year who struggle with wrist and hand pain just like this. These targeted exercises will help relieve wrist pain, restore function, and most importantly, get you back doing the activities that you love. First, let's make sure we're talking about the right condition. De Quervain's tenosynovitis happens when the tendons on the thumb side of your wrist becomes inflamed. These tendons help you move your thumb, and the inflammation usually comes from repetitive motions or overuse, things like gripping, twisting, or lifting. The most common symptom is pain at the base of your thumb along your wrist. You might also notice swelling and tenderness, especially when you're holding or turning objects. Some people even feel a small bump near the affected tendons. The goal of this exercise program is to reduce pain, improve wrist function, and strengthen the muscles around your wrist to help prevent further injury. Aim to do these exercises once a day for about 4 to 6 weeks. As you start noticing improvement, you can gradually increase the intensity or the number of repetitions, but be careful not to push through any pain. So let's start with a quick warm-up. The first exercise is called the opposition stretch. Begin with your palm wide open, then slowly touch the tip of your thumb to the tip of your little finger. After that, open your hand fully again. Move slowly and really exaggerate the stretch. Repeat this 10 times. The purpose of this stretch is to gently warm up the thumb muscles and the tendons, improve flexibility, and prepare the wrist for the strengthening exercises to come. Next, we'll perform a wrist flexion stretch. We're going to hold it gently for 30 seconds to allow the muscles to fully relax and lengthen. Start by bending your wrist downward, then use your other hand to gently apply pressure to increase the stretch just enough so you feel a comfortable tension. As you do this, you'll notice the stretch along the upper part of your forearm, specifically in an area called the extensor compartment. It's important to keep your elbow fully straight throughout the stretch to target the correct muscles effectively. This stretch is designed to relieve tension in the extensor muscles and improve tendon mobility, which can be especially helpful if you're experiencing discomfort or stiffness in the wrist area. Now we'll move on to the wrist extension stretch, which you'll also hold for 30 seconds. This time, bend your wrist upward towards the ceiling, creating a gentle stretch along the underside of your forearm. Use your other hand to softly increase the stretch by applying slight pressure, making sure the sensation remains comfortable throughout. Keep your elbows straight, and that's really important because it directs the stretch to the flexor compartment, which is the group of muscles on the bottom of your forearm responsible for wrist and finger movements. This stretch is particularly useful if you notice tightness or discomfort on the palm side of your wrist. Now we're going to move into some strengthening exercises. Make sure that you start with lighter weights. Keep in mind that the forearm and the wrist muscles are not like the trunk or the legs that need heavier weights. Most people with de Quervain's tenosynovitis should begin with 2 or 3 pounds of weight, or even just a water bottle or a heavier can. The first exercise we'll focus on is wrist flexion. This helps strengthen the muscles and tendons around your wrist and thumb. Hold a weight in your hand with your palm facing upward. Begin by slowly bending your wrist upward, lifting the weight toward your forearm in a controlled motion. Then, gently lower the weight back down to the starting position, taking about 2 to 3 seconds for each phase of the movement. Perform 3 sets of 10 repetitions, allowing a short rest between sets. This controlled strengthening helps improve tendon resilience and reduces strain on the inflamed tendon sheath towards the thumb. Next, we'll do a wrist extension. This helps complement the wrist flexion exercise by strengthening the muscles on the opposite side of the forearm. This balance is important to support overall wrist stability and reduce tendon irritation. Hold the weight in your hand with your palm facing downward. Slowly bend your wrist upward, lifting the weight toward the back of your forearm in a controlled manner. Then, gently lower the weight back down to the starting position. Maintain control throughout the movement to avoid any sudden jerks. Aim to complete 3 sets of 10 repetitions, resting briefly between sets. This exercise targets the extensor muscles of the wrist, helping to improve the strength and flexibility needed for daily activities that involve wrist and thumb movement. Now we move to radial deviation strengthening. To perform this exercise, hold the weight with your wrist in a sideways position with the thumb side up. Slowly bend your wrist upwards with the thumb reaching up towards the ceiling, then lower the weight back down with control to the starting position. This movement is called radial deviation. Perform 3 sets of 10 repetitions, allowing brief rest between each set. This exercise focuses on the muscles that help move your wrist toward the thumb side. Strengthening these muscles is especially important for managing de Quervain's tenosynovitis because they support the tendons that glide through the tight sheath affected by inflammation. Now we're going to focus on grip strengthening. This plays a crucial role in restoring overall hand and wrist function. To begin, use a soft stress ball, a therapy putty, or a hand gripper device. Choose something that offers gentle resistance without causing much pain. Hold the object firmly in your hand and slowly squeeze it. Maintain the contraction for a few seconds before gradually releasing your grip. Aim to complete 3 sets of 10 squeezes. Take a short break between each set to avoid fatigue. Strong grip muscles help stabilize your wrist and thumb during everyday activities, and this reduces strain on the inflamed tendons affected by de Quervain's tenosynovitis. The last exercise is finger spring strengthening using a rubber band. This is going to target the small muscles that help extend and stabilize your fingers and thumb. Place a rubber band around all 5 fingers. Start with your fingers gently together, then slowly open your hand by spreading your fingers apart against the resistance of the rubber band. Hold this position for a few seconds, then slowly bring your fingers back together to the starting position. Aim to complete 3 sets of 10 repetitions, focusing on smooth, controlled movements throughout. This exercise is important because improving finger and thumb control can reduce compensatory movements as well as excessive strain on the wrist tendons involved in de Quervain's tenosynovitis. The goal is to perform this wrist rehab program once daily for about 4 to 6 weeks. As your wrist gains strength and your pain lessens, gradually increase the weight you use during the exercises to continue building strength without putting too much stress on the tendons. It's crucial to listen to your body throughout this process. If you experience sharp or worsening pain, reduce the weight or take a break before resuming. Staying consistent with these exercises and maintaining proper technique will help improve wrist function and gradually relieve your symptoms over time. Lastly, some patients may benefit from targeted regenerative treatments that can accelerate healing far beyond what exercises alone can achieve. In my next video, I'll show you how platelet-rich plasma injections work to reduce inflammation and promote tendon repair specifically for de Quervain's tenosynovitis. If you're looking for a faster, longer-lasting solution to your wrist pain, the next video will show you exactly how PRP could transform your recovery and get you back to full function much sooner.